Lactation consultants are great and they're at your disposal if you're having any breastfeeding issues at all. We work on everything from latching on to milk supply problems to weaning your baby, anything and everything that you can imagine related to breastfeeding, we will fix for you. You have to, though, find your own, just like you would with a doctor. You have to have a comfort level and you have to be on the same page as a lactation consultant. What's good for your one friend might not be good for another. There are going to be some who are going to have different views on breastfeeding, and it really depends on your lifestyle and what you expect out of it. What you need most is to be comfortable knowing this is your go-to person. This is the person you're going to call when you have any breastfeeding issues. You shouldn't feel like you have to hesitate, and you shouldn't feel uncomfortable at all asking anything that's on your mind. If you are, then you need to find one that's going to fall into the same groove as you are. Lactation consultants are board certified. There are breastfeeding educators out there. There are lactation educators. But if you need clinical hands-on help, you want to look for someone with the designation IBCLC, which is an International Board Certified Lactation Consultant. That is how you will know that that person has been through a proper program and has actually taken a board exam to be called a lactation consultant. If you go to the website ilcailca.org, you can plug in your zip code and they will find for you a lactation consultant in your area. If you don't want to do it that way and you have a friend who's been using one for ages, then absolutely go with word of mouth because that's the most comfortable route. You would typically use a lactation consultant from anything and everything, from the very beginning, from a prenatal breastfeeding class on through weaning. Many women, the majority, use them in the first couple of months after they've delivered, just to make sure. In a few cases, you might, not in a few cases, in many cases, moms feel like they're doing fine with breastfeeding, but they just want a breastfeeding checkup, and so a lactation consultant can come in and just examine everything and see how the baby's doing, how you're doing. Then sometimes we're called in for more aggressive issues. The baby's not latching on, mom has no milk, mom has too much milk. There are many different issues, but you should never ever hesitate to call, because getting issues fixed early or questions answered early is really the key to the entire experience. You don't want to wait too long.